Cool. Alrighty. Welcome. We're going to be going over our first episode of this podcast. There's a working title. Nothing's been settled yet on this podcast. But basically, I'm here with Daniel, who is a chiropractor here in Texas. He's in Waco, Texas, no?
Yeah, that's right.
Cool. And I am Matthias. I am an LMT and CES located out here in Houston, Texas. And I'm basically creating this podcast so I can meet other practitioners in the area or across the country to have fun and chat and talk shop and learn everything there is about sport med, chiropractic, PT, manual therapy, all the fun stuff. So how you doing today, man?
Man, I'm doing great. I want to say I have appreciated what you put out content-wise for a while. So, this is exciting for me to be on in general, but also your first guy. So I hope this blows up, man.
Thank you. I hope so too. So kind of like talking about your upbringing and a little bit of like what got you interested in chiropractic in the first place. Is chiropractic like your first career?
So if we're going to go back to the roots,
yeah.
I grew up on a farm outside of Austin. We had 180 acres. Every summer we're hauling hay. There's always something to do. So I guess, not to take this like 2 hours or 3 hours long, but, there was always like work. So my work ethic kind of started there. I graduated, I went to Texas Tech with the academic scholarship. And then I left there before I graduated, took like a 5-year hiatus in the service industry. So I was waiting tables, bartending, doing all the fun stuff that wrecks your body, but you never take time to fix. But and then when I graduated from Texas State, I enlisted in the Navy. So I initially went in with a SEAL contract. So I spent some time training for BUD, went to BUD. Dropped out, man, without a plan. My body fell apart kind of on that one. But, I was 30 years old when I checked in, so I was an old man out there. So then I reclassified into a job called parachute rigger. So I spent 3 years doing deployments on carriers, taking care of air crew gear.
Okay.
Like make sure all the safety stuff was good to go. But I knew it wasn't my spot, I took on responsibility really quickly with that. So I ranked up pretty fast, and I was kind of running the shop on my shift as a shop supervisor. So then, I got in good with our leadership. They knew that I had a goal back to get into special operations again. So I eventually put in for a package for special operations parachute rigger, and I got that. So long story short with that, but we did a lot of intense training, a lot of parachuting, a lot of falling into the ground, and so whenever I did my medical exit exams and stuff like that, they were putting me in for medicine, surgery, or physical therapy and chiropractic, and up to that point, I hadn't had a whole lot of experience with chiropractic. Just as skeptical as the next guy. Basically, it's like, okay, I heard that if you get adjusted once, then you gotta get adjusted for life and all this stuff. But then when I had my actual experience with it, it was, I had some good chiropractors, good physical therapists that, really tuned into my anatomy. And wanting to find the whys of the sort problem,
right.
And whenever you get into a situation like that, you can tell the difference. I mean, you go to a mechanic and they might specialize in one thing. It's the same for, I feel like, every field of work. You can find people that are different that vibe more with what you need.
Yes.
And I found some guys that were all about movement and motion and restoration of that range of motion. And I wouldn't say that it fixed me, overall, but I would say that the tools that they gave me and the work that they did made a noticeable difference in my life, not just my physical side, but, there's a whole mental aspect to feeling like you're not 100%.
Yeah.
And when somebody taps into you and gets you closer to your maximum potential, then yeah, whenever I got all the way done out of the Navy, I used my benefits to go to chiropractic college down in Pasadena.
There you go.
So I went to Texas Chiropractic College, graduated down there, and then it was awesome running from there.
Nice. Heck yeah, that's pretty cool.
Yeah.
Yeah, I didn't know you went to TCC. That's cool.
Yeah.
Nice. Yeah, I meet so many of their graduates. I guess because it's like right down the road from me. Worked with some of them. So, and I can just tell that like it's definitely it's cool to see it because like you started with the story of saying, yeah, just as skeptical as the next guy, and I still hear that, from every now. I think it's becoming less and less, but because I also work in this field, I know that what chiropractic college is now doing, as opposed to previous generations, is they're integrating a lot more exercise science. It seems like, it's not just you're here to learn adjustments. Well, yes, but you're going to learn a lot more than just that, right?
Yeah. Yeah, and I could say, speaking specifically for TCC, I wanted to be in Texas, and there's only two in Texas. There's one in Pasadena, there's one in Irving. And so, I'm more of a Houston person myself, but I also, when I toured TCC, the day that I took my tour, I ended up going into the anatomy lab, and the dean of the anatomy department was doing our walkthrough. And so we sat down and we were talking and going over, basically same stuff, history, why are you doing this, where's your mind at, that kind of stuff. And then he just looked at me and was like, hey man, you want to hold a brain? And I was like, because we do a full cadaver lab, 3 trimester of anatomy. And, we were in the anatomy lab.
Wow.
So he pulled up a cadaver, out of the tank, hands on, like gloved up, hands on. And that was just something, that in my mind took me to the seriousness of what was about to happen.
Yeah.
The respect that you give to people who donate their bodies to science. And whether it was, intentional or it just kind of happened that they ended up there, just the amount of respect that we were, it was instilled in us to just, first and foremost, respect their bodies because they are the ultimate learning tool. And they ended up there somehow. It doesn't matter how or what their story was. The fact is that their body is there. You're going to be touching it. You're going to be dissecting it. You're going to be going through each and every little piece of it. And so that's, just remember that it's also a person that had a life and a love and, all the things about empathy for the person and understanding.
Yeah, big time.
The whole thing. So in my mind, I just solidified it in that moment. This is where I want to be. This is the part of Texas that I want to be in, and the intensity of that moment kind of shockwaves through the whole thing, right? Because that's the starting point of my this is where I'm at, and this is what I want to do. I know that not every college, not every chiropractic college does a full-on cadaver-based anatomy lab. And so for me, it was just, if I'm going to go all in, I'm going to go all in. If that's the thing. I wanted my hands all the way into the muscles. I wanted to be pulling on tendons and seeing what happens and doing range of motion stuff that I can visually see what the connection is between proximal to distal, all of the things. And it was not easy.
Exactly. I don't know if you know him, and shout out to him if he's watching, but his name's Alex Chapa. He's attending TCC.
Yeah, he was actually in my wife's class.
Really?
Yeah.
That's cool. Yeah. He and I...
In his partner, I don't know if they're married or if they're engaged or anything like that, but I know that they have a really good movement-based practice too. And I love seeing the content that they put out as well. It's not just fluff, they're actually putting people under load, going through functional movement, and finding out how to make people better. I love that.
Yeah. When I was having a conversation with him one time, and I didn't know that at the time, I remember this might have been a year ago or so, but when he told me that he had dissected and he did cadavers, I had never heard of that for chiropractic. I figured it would be for PT, but for chiro, I didn't know. And then I was like really surprised. And then now, me being an LMT, I'm like, I kind of want to sign up. I want to go take one myself. I want to see it too. Like you just said, I want the proximal to distal. I want to know. It just helps you.
Yeah. The virtual anatomy is just not the same. You can look at any kind of cadaver-based anatomy book that goes all in on the real body. It's an actual dissected body, but you still don't get the tangible effects. You know what I'm saying? Like tracing muscle belly to the insertions and origins and get there. But I will tell you another shout out. Dr. Chen was in my class, and that dude was an artist with his dissections. I'm talking like taking out arteries in the brain and like negative space, like removing the brain matter and leaving the arterial pattern there and the structures there. And just, having a scalpel in my hand and knowing what it takes to do a clean dissection, that dude was a master. And honestly, like we use so each trimester has their anatomy section that they're doing, but then the other trimesters below will use their body for testing purposes. So everybody's teaching their body basically by when they dissect. And so you're going through and looking at somebody else's, their project basically, their display. And then, the professors and doctors would come and pin certain things for the testing purposes. And you want to find the people that did the dissections to make sure that what you're seeing is what, equals what they labeled.
Okay, yeah.
You get to prep yourself for the test based off of who did the dissections and honestly spending more time in the lab. Like I camped out in the lab, not as much as Dr. Chen, but the amount of time that I spent in the lab, I think provided a very stable launching pad for the rest of my understanding of anatomy.
Freaking cool. So cool. Yeah. I see a lot on social media. I see on here and there from different like PTs or the cup therapy guy. I know he's put out a couple as well. I know he's doing studies right now where he's putting cups on cadavers, on like dead bodies, and seeing how that's interesting. That I want to see in person eventually.
I'm not skeptical about that. I know the effects of cupping, but live tissue is just so much different. So good. Get to see some variables. Get to see some effects. But just know, like as you know, when you put cups on live tissue, the amount of change that can happen immediately with the malleability and the stretchability and elasticity of the skin and muscles. The effects of that. I pitch it to a majority of my patients who come in with shoulder pain, low back pain, spasms, whatever. That hey, this is a very non-invasive form of treatment that can get some viscosity back between your muscle layers. Get into those trigger points and help. I don't even say break them up because I don't believe in that so much as like just provide some taking a Velcroed muscle and getting it to glide and slide like it's designed to do. But a lot of good stuff with the cups. So if he comes out with a published study, I would definitely like to take a look at that.
Yeah, be interesting. Very interesting. You did say something there that piqued my interest, and that was, and I believe in it too, what you said, but I had a funny conversation with another LMT the other day, and she's newly licensed. This person hasn't been practicing very long, but I told them, I don't believe in knots. I don't believe in muscle knots. And she was so shocked and so baffled that I said that. And she's like, well, when you're palpating, you don't ever feel like a knot. And I'm saying it's the way I said it, and I still find a struggle. Maybe you can help me. but I struggle to kind of make it be like, look, it's not that there's not. I see why you call it that. I totally get why you call it that, but it's not an actual lump. That the muscle itself decides to just tie itself into this little thing. That's not how that works, right?
Yeah.
There's so many. You're contracting and moving and putting favoritism on one side when you stand, walk, sleep, and eat, and you know what I mean? That all plays such a factor in why one particular muscle group could have more tension than another upon palpation. And that's really why when you press somewhere and someone's like, oh my gosh, but then the next person you press in that same spot again, they're like, fine. Yeah. And you blame it on pain threshold. It's not pain threshold. It's the fact that the way that this person moves is so different from the way this person moves. And I'm struggling to find a easier way to put all that down into one sentence.
I think you're doing a good job by breaking the mold or the paradigm or the structure that people try to put everything into. Because everybody's body is designed similarly, but there are so many congenital variances and, like I said, motion patterns and those kind of things that from the time we start putting our body under load, our muscles and our system is adapting to that kind of input. And so if somebody comes in and I have a knot in my back, then I like to do just the same thing that you did. Is explain it in a calm, peaceful manner.
Yeah.
Guide them from being locked into the theory that their muscles are somehow, and in theory, the lack of range of motion is true. I kind of describe it as instead of a knot being more like when you have a chain link, and you just twist it up. And so normal chain link is a certain length, and then you start to twist it up, and it, you can't physically move it that distance anymore. So rather than think about the muscles twisting like that, think about the lack of range of motion. And so in that example, I'm not saying that your muscles are twisting. I'm saying that the analogy is that you at one time had a full length of chain, and you shortened it in a physical way to make it not have that same range anymore. But then I go into anatomically, your muscles are like Twizzlers, basically. They're just a series of small cables, all of them wrapped individually, and then all of them bundled. And all of them kind of working together off of, electrical impulses. But whenever you have an adhesion or a trigger point, a knot, whatever you want to call it, then in theory you should be able to find a way, unless it's a scar tissue type issue, to restore some of that like I said before, the viscosity between the muscle layers, because that connective tissue is kind of what binds up. And rather than say a knot, I compare it more to Velcro. And so whenever you lose the ability for the muscles to glide and slide across each other, normal patterns, they've gotten some sort of adhesion to where they stick, right? And so, when I feel like I've had a lot of success explaining it like that, where it kind of stuck together better than I have saying it's not a knot. It's people get locked into their terminology and they're going to repeat it over and over again. But if you signal something to somebody and it sticks differently, then I feel like when they repeat things again, then they'll be a little bit more informed about the actual physical nature.
It's true. No, that's very true. I attended a continuing ed course. What are we in April? This must have been like 2 months ago or 3. And it was all about assessments. It was an assessments-based course for basic range of motion and mobility and different things of that nature. And the instructor, she said that when people say muscles get tight, she's like, try not to say tight. Try to just say stiff. just something a little small shift like that. And she had this interesting way of describing it where she got two resistance bands and wrapped them together and it formed it so there was a tie in the middle and she pulled them apart simultaneously apart, but that little tie in the middle favored going toward one side or the other, right? So that was her way of it goes back to your chain analogy. And I think that's literally what I thought of as soon as you were describing it. I was like, yeah, there you go. That's a good way of putting it. I like that.
Yeah, yeah, and that's just country thinking. I chain up my trailer to the truck. What do? I twist the chain. So I feel like another reason I've had good success with a variety of people is my way of not just locking in on one comparison. So if I'm talking to a sports related patient, then I'm shifting my gears to performance based analogies that really cue in on the training that they've had to put them in the position that they're in. Whereas if I was talking to a law enforcement agent or like a first responder, then maybe I shift into more of a different framework of comparison that may have more of a social aspect to it. Like it's just all about who the person is in front of you,
right?
And as long as you have an understanding of what your goal for instruction or information or any of it is, like you as a person can change the way and the fashion that they're going to understand it.
Definitely.
Yeah. So I would say, have great ideas about how you want to explain things to people, but then understand that even the best explanation is going to bounce off somebody's head if it's not applying to their body, their mind frame, anything.
Right. Yeah, that's an interesting way of thinking, and that kind of helps me actually a little bit because actually before we called today, I had a client message me, and I don't know if your clients have ever done this. I'm sure they have, but he messages me and he sends me a video from the internet and on social media. And it's another person. I don't know what credentials they have. I don't know if they're qualified, not qualified to speak about what they're speaking on. But this person in this video is saying, well, every time you walk, your core is stabilizing, your glutes are stabilizing, this and that. And so here are some exercises that are good for if you have this type of pain and da-da-da-da-da. And I mean, it wasn't a bad video. It wasn't necessarily anything that was like worrisome or whatever. But then my client sent that, and then they sent a message saying, so is the reason my knees hurt because of my ankles? And then I'm thinking to myself, I'm like, this is where social media can be a bit of a nuisance in this space.
Well, kudos to thinking, chain of, like kinetic chain.
Yeah.
I do talk about feet and knees and hips and low back and shoulders all in one sentence.
Yeah.
But to summate that in 30 seconds and say, is this why?
Right.
Break the ice, let the people think. Those are what these quick videos are all about. And I feel like, they serve a purpose, but you're right. You got to look at who's sending them.
Yeah.
And what the depth of their understanding truly is.
Yeah.
People will get steered wrong off of a 5-second clip for anything. Whether it be political, that's another podcast. But anatomy, anything, they can get steered wrong quickly. And then how long does it take them to break their understanding of what it was that they initially latched into?
Big time. Yeah, what I ended up sending him. I think with and you alluded to this a second ago, like the person in front of you, and you should understand, at least to some capacity, empathize and try to understand their background. And if I say this to them, how will they perceive this as, right? And I think that's really important. And the way that I've always looked at things like that, when people ask me, is the reason that I have this pain is because of this, right? Or especially in this context where this guy's alluding to a video on the internet. And I try to kind of be a little vague, especially if we're not in session and not in person, right? It's mostly because I don't want to overload you, but for the most part, I just want to be like, just be like, do this little thing, And I'd rather just be like, I wouldn't necessarily blame the ankles, but also, who is this person?
Yeah.
Ask yourself that first before you even do anything else. Yeah.
So let's dig into that though. I mean, we got time. Let's say somebody comes in with some knee pain and no history of accident, trauma, those kind of things. Like I personally, I set up my first initial appointments as a 45-minute session. And I try and block that whole hour out because I know how verbose how much I can talk. And if I have somebody else that's in the room that's just as talkative, we might get off on a tangent, but that's where the real answers are sometimes. So somebody's saying, like my knees hurt. Well, I'm saying, okay, activity-wise, where you blah, 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 what led you to the knee pain? But also, when's the last time you changed out your running shoes, or your work boots? Like, do you ever just set them on the floor and look at them? Like, what do they look like? Are they here? Are they here? Are they here? So ankle ties to knee problems. That is a valid thought. And to not like skew them away from a certain brand of shoe or anything like that, but just to look at the latent wear pattern and decide, what is that doing to your ankle? Because if we look at the structure that goes inside of the piece of equipment, then that has to adapt to whatever is being channeled through the force whenever you with every step. So for that specific example, with knee pain going to the ankle, then I would say let's dive into that and see what the actual foot muscles are doing, what your arch looks like, where are the trigger points in your feet? Because that can make a huge difference in a ton of pain.
No, big time. I would agree. What I do, because I've treated this individual for a few weeks, and my thing is, whenever anybody comes to me with knee pain, my first initial question is, it's footwear and lifestyle. But then it'll move into an interesting question that I like to ask, which is it above or below or in the middle? And that kind of can be very telling, because of my general rule of thinking is like, if it's above the patellar, it could potentially be more related to hip, right? But if it's a little bit more below, then I'm more inclined to think tib, gastroc, potentially, right? Or a combination. It could be that too, and
that's the interesting thing about anatomy is that the puzzle pieces don't always fit when they should, and so again, with getting locked into a specific way of thought, it's like somebody who says their IT band is tight. I mean, okay, let's slow down a second and realize that the IT band is just connective tissue. It has no actual control of the muscles. It has a way of making a barrier, but it doesn't actually affect the musculature itself. So whenever you're getting deep tissue massage on your IT band, hey, go for it. Like, you get my secrets if you do that. Like, I'll give you everything. But if we're not looking at quad and hamstring imbalances or issues in general, then the IT band's never going to change. IT band's going to be IT band. It's going to be what those muscles allow it to do.
Right.
And then the knee problems, like you said, coming from the hip, IT band from the hip down to the knee connection, but all those muscles are plugged into it. And so if we're trying to address a knee problem and we're not looking at quad and hamstring and even distal to that into the calf muscles and anterior lower extremity, then you're not getting a full picture. You have to get the full picture.
Big time, always. And I think it's in. I've almost been. Well, this is where I think like Cairo and PT is really a mixture of an art form and a science, right? But people don't know that, that they just kind of go, you went to school and you know what you're doing. I'm just gonna trust you, right? But this is where it becomes an art and science because lately I've been playing with different assessments and muscles. So it's like if I want to know for a fact if something's weak, yeah, you can do muscle strength testing, and now they make tools as well, like punch into the wall here, and it measures how strong this right arm is compared to the left, right, or the rotators. They make those. I've seen those, and I think that's freaking cool. But what if you don't have access to those, right? And so my thing that I've been doing lately is like talking about quads. If I want to know how strong your quad is, just do a single leg bridge and just hold it for a minute. Are you going to start shaking? Let's see.
Automatically.
Yeah. Right.
Yeah.
And that tells me, yep, there's weakness there in the quad. Or same thing with hamstring there. You could what could you do with hamstring, like a hip airplane? You could do something like that. See stability a little bit there too as well. See a B stance RDL. But isometrically load it, however, there's so much variety there and so much to like, and that's the thing I think I like, because I dived into the black hole of assessments there for a while, and like orthopedic assessment for a minute too. I didn't know there was like over 300 orthopedic assessments out there.
I got a book with probably like 1,000 of them.
Yeah.
But yeah, it's crazy.
Yeah.
The amount of different people that put their little twist on it, and call it their name, but ultimately, you can categorize a ton of them into one or two instead of 15 that are all expressing the same thing. But no, that's what I'm saying, man. Like, I really love watching your content. I've never met you in person, but I see the amount of thought that you put into trying to find the root. Because anybody can walk around and pull stems and flowers and anything out of the ground, but whenever you find the root, then that weed typically dies off, right? And so if your problem with your hamstring is more actually in your glute than in the belly of the biceps femoris or whatever, then or I'm sorry, but it's like the muscle belly itself, then you're looking for the actual cause, and that's what you're testing, and that's why I appreciate the depth of service that you give to your people.
Oh, dude, yeah, likewise, man. Yeah, it goes both ways, and it's, I think whenever you and I first chatted, you were telling me a bit about you and stuff, and I said, I'm just an LMT, and you had a very nice response, and you said, there's no just, and I still feel, maybe because I'm young. I'm 26, by the way, and I actually just came back from school right now. I'm in my bachelor's right now. I'm finishing up in exercise science. Yeah, trying to get that CSCS is what I'm working toward right now. Yeah. But I'm doing these things not just because of like it would be nice to have. Yeah, sure, it would be nice to have the CSCS by my name, but also I know the weight that it carries, and I know that it's going to actually make me a better practitioner in the bigger thing of it all,
Yeah, and I think that we continued that conversation into like a depth that like really explored more than that. But on the surface, I can tell you as a doctor, a DC chiropractor, whatever people come into the office and recognize me as, I still, no matter what treatments I give, no matter what the effectiveness, how much change I make in their life, they will still tell me that then when they go to their real doctor, they have these other things that are said. And, like, I stopped taking offense to that because we've all been programmed into what doctors in America are. And the respect from society to a medical degree is always going to be a little bit different than the respect that anything else is. So, like, you can take any kind of terminology, any kind of qualifications that you get, you can stack them up to the roof. you're still not going to live up to everybody's, like definition. And, like my ego personally, I don't correct that person that says, that when they go to their real doctor. I prefer to go more along the lines of, I understand what you mean by that, but also how long have you seen this doctor?
Yeah.
Oh, it's 15 years. Okay. Have they ever approached your symptoms and your problems with a hands-on technique? No. Okay.
Mm-hmm.
Well, that's the difference between my version of being a doctor and their version. I use these, and I will tell you everything that I'm going to do before I do it, the reason why I'm going to do something, what I'm checking for, what I feel in your body, and I don't take offense to you not understanding that I'm a doctor. Like that.
Yeah. Well, people don't know this, but Cairo means hand, right?
Yeah.
That's so like, there you go. But
you have like I'll dig back into the stigma for just a second of the respect that is or is not given. But you have people that don't vibe with chiropractic specifically. Another very famous podcaster in the Austin area now will often say that chiropractic is a pseudoscience. Well, I would love to contest that, and I would also like to hear about the experience that they had with a chiropractor that made them feel like this version of healthcare isn't a real, tangible, effective way to give somebody actual treatment. Yeah. Because you can, like I was saying earlier, you can go a variety of places and receive a different product from the same, section of the workforce. Right. But you can also go to somebody that is different. And as long as you trap everybody in that same box, then you're going to be minimizing and doing a disservice to anybody who follows you. If you're trying to say everybody in this profession is the same and they're all, pseudoscience practices. Yeah. I get it. Like if you look at the history of chiropractic and you say, the guy that started this was a whack job. Yeah. Everything that he talked about was crazy. Okay, I get that. Yeah. But evolution in science and in medicine and everything has taken from its roots and changed over time. Yeah. It's not just chiropractic. Right. Like we're not bloodletting so much anymore. Like we're not amputating as the first line of defense anymore. And so if you look at the history of medicine, you can say also, well, all those people were nuts. Lobotomies, okay. Everything has to have a accurate historical picture passed on if we're trying to tell people the truth. Yeah. And it's not just one profession, it's across the board that there's accountability for your word. And so if we're looking at why our healthcare system is defunct and busted up, and we're only telling people that going to a medical doctor or on the other side of things, only taking peptides and supplements, then you can't just summate everything into one or the other. Like you have to be able to experience a lot of things. Yeah, no, I mean, I went to school over here, actually just up the road, San Jacinto College, and they have a massage therapy program. And at the time, my instructors are no longer there, but that the instructors that were there were a woman who was nationally certified, and then a man who was a doctor of Chinese medicine. And a little slight backstory on me. I didn't want to go to school for massage. I wanted to go to school for physical therapy assistant. And my parents, growing up, as I reached into my early 20s, were like, "Hey, we know that you want to pick that, but can you pick something faster?" They wanted me out the house.
And so I settled on massage. But I when I met this gentleman who was a doctor of Chinese medicine, I thought, whoa, that's cool.
Yeah.
And he started talking about ART. He started talking about needling, dry needling. Started talking about scraping. Started talking about cupping. He showed us fire cupping. He showed us TMJ and like just different things and things that were so different from the other instructors of that I had met prior in the program that I was like, this is like piquing my interest. You know? And I remember being skeptical about acupuncture for a while there, and I know it's meridian lines and chi lines and these different things. And when I went to go see him, I had some bloating issues, and I what I did is I said, hey, I'm bloating, can you help me? And he said, in exchange for content. And I was like, done, I got you, whatever. And he was like, all right, so here's what we're going to do. I'm going to have you stick your tongue out. And I was like, what? I was like, yeah, stick your tongue out. Takes a picture of my tongue, starts pointing out different areas on the picture. Like, well, this part's brighter than this part's darker than this part. That means XYZ, right? And now you're enthralled in this experience where you're like, whoa, that's different. You know?
Yeah, the color of it, like how is it scalloped? You know, like everything about your tongue is like. I'm a big fan of acupuncture. I didn't follow on with like licensing portion of it, but I took certification because I was more interested in dry needling personally, and that was a good way to get some hands-on, 100 plus hours of hands-on treatment. But yeah, go ahead with the follow-through.
And it was so, I haven't had bloating since. Let's just say it, put it that way. I haven't had any. I can't tell you why. That part is beyond me at this present time. But I was really just like, wow. Like, I mean, it took a day, but I haven't had any bloating since, and I haven't changed much of my lifestyle. That's the.
Well, you hit it. I've had quite a bit of acupuncture on me. The VA is quick to put people into acupuncture, so it's a very quick option that they have if you're willing to do alternative medicine or complementary medicine. But you were talking about meridians and energy channels and connecting and removing the blockages of chi. Like, I'm a full, our body is an electrical system. Like we are a whole network within each and every one of us. And so it makes sense to me that, if I can't turn on my light because the circuit's not connected, then that something in there needs to be repaired, and it's the same kind of concept with acupuncture is that, something in there is blocking that connection. And there's a visceral tie, there's an agonist, antagonist on every level for that. And so, getting in there and them finding where that system is, faltering or just not firing on as it should, and connecting hot versus cold, and all of the things that they do so well makes sense to me. And I verbalize that to my patients who are looking for acupuncture, but I'm letting them know I don't do that version with these needles. Same needle, different concept. And so I will also, I don't take away from anybody's profession. And I'll give you another key of success for me that I've learned is that honesty and being humble and having a network allows me to know that I'm not the best fit for somebody, but I know somebody that is. And so if I'm like, 3 treatments into a 6 treatment plan, and I'm not seeing change, then I'm thinking, how do I adapt my treatment? But also, is there another profession that could tap in right here, make a positive change, and then as we co-manage, I will see that patient back, and I get thanked, for sending my business away, not just from the patient, but from another professional who notices what it's like to be respected, and that their skills can also provide a very valuable, source of healing at the right time.
That's a good point you bring up, because I recently did that with my business. I basically I when I got my CES, which those who don't know is corrective exercise specialist. That's my cert that allows me to help use exercise as a means to correct movement dysfunction, right? And so that doesn't grant me the authority to fix your torn labrum, right? Like, and I get that question as well as sometimes is, well, would you want to? Would me personally, would I want to like do rehab on an AC tear or anything of that nature, fixed thoracic outlet or something? And the answer I've really, and maybe it'll change later in life, but for right now, and I really had to sit with it for a minute, it's no. The reason being is that no longer becomes fun for me. You know, it's fun for me to do these mobility assessments that are non-diagnostic, right? And I can be like, your internal rotation, terrible on the left, great on the right. Why is that? And I get to help you figure out that why. You know, that's fun for me. It's no longer fun when it's like, oh, you have pain when you do cooking. And it's like, okay, well, that's interesting. You do further testing. You do see range of motion good. Now throw in a little bit of orthopedic testing. You keep failing all the orthopedic testing. At that point, I'd rather be like, let's go have you do some imaging, you know, so we can really like know for sure what's going on here, you know?
That's you know, like, I would say you're doing the things that are necessary for any role. Like I do the same thing. It's like, you know, is it fun to treat TOS and you don't get a result? No, that's not fun.
No.
But whenever people come in and they've been bounced around between 15 doctors and they say after, you know, like 15 minutes of all those tests that you've done, and then finding areas of impingement with your, you know, like professional prowess, you know, they also appreciate that very much. And so while you know, like, our level of satisfaction may not be climbing through the roof on some of these conditions, for them, it chisels away at so much pain and anger and anxiety and all the things that each time that they go to a doctor and they describe what's going on in their life, that they're putting it all out there and they're just hitting a brick wall on all of these things until they get to somebody that puts their hands on them. And also being very honest from the beginning of understanding a situation or a person's symptomology and saying, like, I know that you're not diagnosing, but when I diagnose and I say, you know, this is a very blanket term, but let's say that it's thoracic outlet syndrome because all the tests say it is, and the body says it is. They haven't had a diagnosis that fits them up until that point, and then, you know, each conversation is really about realistic expectations. And when we set our goals for treatment, our goals will be very minimal in the beginning. And then as we chip away at it, what we should be seeing is getting back to that, you know, maximum medical improvement range, to where, like, we found what their new norm can be. And it's changed drastically sometimes from that beginning. Like, I can't go overhead for more than 2 seconds or everything's just, you know, and now I'm painting again, you know, I'm able to do it, you know, I'm back to work. I'm making my money without like struggling every night when I get home. So don't discount the reduction of fun for the impact.
That's true. That's true, and that's why I started it with saying it'll probably change later. You know, because and I do because, like, I definitely can see that value for sure. Like, I think if massage therapists had the scope eventually to do dry needling, I'll be first in line for sure. Because I know, like, it goes to exactly that point. My success rate of certain things that will come across my way, like TOS as an example, would be further increased, you know? I mean, yeah, you can do the nerve flossing with the cups on. You can do certain things to try to decompress around it, you know, stuff like that. But you can also, when you get that ability to also do other modalities, you further increases that success rate, right?
Yeah, which brings me into the pitch for chiropractic. Like you were asking the why of chiropractic earlier before we started recording. And, you know, it was the vast array of treatment options that I don't have to ask anybody about. You know, as a PTA, I think in Texas, or even a physical therapist, I think that you only have a short window of time that you can treat somebody, and if they're not better, then you have to refer them back out to a orthopedic specialist or the primary care, or whoever it might be that you have to legally, professionally follow their orders at that point. And if they send them back to you, then you're kind of guided. Well, for me, I have a like in my training, if I'm not getting the results that I think that I should be getting, like you said, well, do we do imaging? Is there a better fit for this person somewhere else? Or can I switch the modality from cupping, flossing, ISTM? Can I switch that to shockwave and get better results? Can I switch that to the dry needling and get different results? And I'm not asking anybody, and that was whenever I was going through because I was weighing out, should I go PTA and then eventually, doctor DPT, or should I just go chiropractic and sacrifice some of that, I wouldn't say notoriety, but respect within the medical field and be a chiropractor, which I'm not shitting on chiropractic at all, but I'm saying, the social, kind of
norms.
Echelon and class system or caste system of doctors. But yeah, so then I looked at the DPT program, how intense it was, the time that it took, and then the results afterwards were that I would always be working from my understanding, for the insurance or for somebody else, under somebody else's direction. And I'm not that kind of person, like I did that enough in my life to understand that if I'm going to make a difference, then I should be the one that can steer the ship. And, if I need to throw a life preserver out to somebody and send them to imaging, then I have no problem saying, listen, I'm not getting this done. And you need to see somebody else. And come see me later after you guys get the imaging, MRI, ultrasound, CT, whatever we got to do. To get to the root.
Yeah, no, there's a lot of what I've looked into, and actually one of my mentors, Coach Casey, she and I met in person. She was the one I did the assessments course with in person, and I've shadowed her a few times for her coaching and things like that. And one thing she really talked a lot about was the gray as far as an LMT goes, because it's a lot of linguistic gymnastics, when you do, I think it's funny that, like, a good example of that would be like, there's joint mobilizations, right? Not manips, right? We're not talking about like an adjustment. We're talking about like just this little bit of like a mobilization. And then a massage therapist can do the same technique, but you have to call it traction. It's the same thing. Gotta call it traction though. It's like
that gray area is like where people, I think that they get exploited a lot of times, because you can be doing the exact work that I would be doing, have to term it something else, and then let's say in one scenario somebody gets hurt, and their massage therapist, their LMT, was saying, I'm just gonna, they're describing a manipulation to the patient, and then the patient gets hurt, and they describe that to their doctor, and the doctor, to their lawyer, and their lawyer says, oh, well, that's out of their scope of practice. They can't. But all you were doing was doing a passive range of motion check, but something went wrong. But all of that passive motion check is, range of motion assessment is within your scope of practice.
Right.
But the litigious nature of American society is just looking to exploit that kind of thing. So it's very important that your documentation is on point, that your terminology that you're expressing to your clients, your patients, is informed and accurate, and that they understand. So for like you, they understand exactly what you're doing and why, and what you're not doing and why.
Exactly.
Because if they're allowed to fill in the blanks to somebody else, then that somebody else is going to take their picture and run with it.
Did you it is kind of off topic slightly, but did you hear about recently that girl that died drinking like 6 Alani New energy drinks a day?
No.
It was recent. Some girl passed away recently because she was drinking 6 Alani News every single day, and now her parents are suing Alani New.
Yeah, well, I mean, the product is on the market, like I'm saying, man. There's always somebody's looking for a reason for just about anything, and it's unfortunate that the parents aren't saying, "Well, why was my daughter drinking 6 energy drinks a day? Like, what was she going through that she felt like she needed that much caffeine or vitamin B complex or whatever is in those things that promotes high energy?" Was the like this is just a tangent, but were the parents putting so much pressure on the kids to succeed that she felt she had to stay up 18 hours a day studying?
Maybe.
Where's the culpability in anything?
Yeah.
But that's just a random. Don't tie that to the specific scenario because I don't want to get sued or anything. But
we don't know.
We don't know.
Yeah.
And that's the fact of the matter is that they don't know.
Yeah.
The company didn't know that the girl was drinking. Like they weren't giving her permission or prescribing her things.
Exactly.
It's consumerism. Like that is what that falls, and you cannot sue consumerism. It's just not possible.
No, yeah. And now I'm sure it's going to be this big, long mess. And then they're going to have to deal with that for a while. And it's...
They had to change their recipe.
Or make it say something on the side of the can or something like that, right?
I'm sure that it already does.
Yeah.
It's just like the Claymore mines, they say face towards enemy. This side towards bad guy. Something bad happened, to where that had to be written on it. But a viable tangent, like that, applicable to a lot of things in society right now, where the blame is just shifted, and the true person or thing that is responsible is no longer even a consideration. Like free will is a thing. That girl unfortunately chose to do something that harmed her. And it's legal. That's a legal substance that she chose to imbibe.
And that's I mean that's and coming back to our profession, that's where liability and having forms and things like that. Hey, we got to get you to sign this before we get started. Like it's just standard practice, But it also goes back to what you said. Be careful how you word things, and more so me. As an example of that, I had a client yesterday. Really, really bad irritation of the bicep tendon, right? And I don't know if you just picked that up, but I'm specifically not saying bicep tendonitis, right? So in my way, I'm phrasing it. It's just irritated, because if I say bicep tendonitis,
it's a term that gets locked up, and then you're diagnosed. I didn't go through I just jumped straight in, and I went to chiropractic college. I have a lot of respect for the people that were in my class and that went through school above and below my specific class, but that had gone through massage therapy school or gotten their degree in kinesiology or some form of motion and hands-on assessment, because I felt that they were ahead of the game with technique, with understanding, with bedside manner, you name it. And me, I came from the Navy, where it's like, you do as you're told, you follow these things, even if they didn't make sense, because that's the rigidity of the structure, where, other people had different backgrounds. And I learned from those people, I picked their brains. I, tried to get their hands on me so I could see how are they finding, subluxation, how are they finding the resistance that shows them where they need to spend more time? Because I didn't have those tangible skills. So much respect for the building blocks that I think would make a more successful doctor of chiropractic, doctor of physical therapy. If there was a 6-month portion of your training career where you were physically just giving massages, and I say just, I'm saying that because you're not doing the other side of chiropractic. You're solely doing manual therapy on the human body. Because I think that if we had that going into practice, I would have personally had a much different approach to providing health, providing healing portion of my treatment.
Yeah, and it's funny you say that because that's partially why I'm doing workshops right now. I got my massage therapy instructor license sometime at the end of last year. I want to say in October. And the reason I did that, yes, I would have liked to go back and teach at a school or something, but also I invite students of chiro, PT, and massage to attend my workshops for that exact reason, because I know that it'll just make you that much more of a better practitioner. It's a really different mindset. When I went into school, I was so nervous to touch anybody, but then as soon as I started to get that confidence up, it changes your whole confidence and the way that you practice.
Yeah. Yes. You could tell, somebody that had never touched, and I'm speaking specifically student clinic, whenever you actually start to get in there and start adjusting. In somebody's hands, when they're on you, about to do an adjustment, you can tell how confident they are, and so those people that have been through the process of making somebody physically relax, not with their words, but with their hands, then that's a sizable difference. And I think that those are some of the big learning pieces that I took from people that had that experience was, don't come in hot, you just come in with a mission. You have to gradually work your way deeper into the muscles with slight pressure, and then it's not just a one spot area. You have to trace the muscle itself. There's technique to everything, and that was something that you can learn it by spending a lot of time doing it, but you can also learn faster by listening and feeling and picking the brain and I see you have something that I don't have. I'd like to learn it. It's all about swallowing your ego, swallowing your pride, and understanding that to truly learn something, you have to appreciate and acknowledge the fact that you're not the boss. You're not. You're not the guy. And I do that all the time. Just in those 5-minute videos that you're talking about, somebody's adjusting, and there's a lot of good adjusters out there that put it on camera now, where it used to be kind of taboo or whatever, but that are doing techniques that I say, okay, I see the why of why they're doing it like that, structurally and anatomically, physiologically, what the results could be and how they're positioning their body, and that differs than maybe I do mine. And so, okay, well, maybe I'll have better results. So I start to slowly implement that in, and I feel like I'm not using that as I'm using patients as test dummies. I'm using my skills and adapting to the body type in front of me by changing my understanding of a setup or a drive or a contact.
Yeah.
All the things. Yeah.
No, it's cool. Yeah, exactly. Well, the moment this is gonna have us wrap this up, but dude, this is so much fun. Thank you.
Yeah.
I also feel like I learned a thing or two. So yeah.
I feel like I talk about stuff that I don't usually talk about sometimes. So it's honestly it builds everybody in the room whenever you're just discussing what you're passionate about.
Yeah.
And what you love to do, and it's like I took a forced year and a half off in a non-compete and built this clinic.
Yeah.
So I had a real moment of transition whenever the physical work on the building was done, and I realized, oh shit, I got to be a doctor again. And it took all of that. I'm very compartmentalized sometimes about okay, I have to shift my mindset to completion of this task. And then when that's done, I have to shift back into all that training and all that experience and all those conversations again. So, I thank you for the opportunity to be able to get on here and throw some words out.
Yeah, it's good stuff.
I hope that some of them stuck and some of them made sense to anybody that listens.
For sure.
Yeah, I appreciate that.
And congratulations on your practice.
Yeah. Hey, thank you so much. Yeah, anybody in the Waco area, McLennan County, make your way over here to East Waco and see what we did. It's not just a cold building. This place is like filled with my energy and my devotion to making it a calm, a safe space to where you can come in and just give me a truth about your life, and then we can try and find a reason or how to get you back to where you want to be.
Yeah.
But yeah, I'm super fortunate and blessed, and my wife and I, and now Lila, our daughter, all of us have thrown down our gauntlet here in Waco, or thrown down our trident here, and are really trying to make a difference in the community.
That's awesome, man. I love to hear it.
Yeah.
Well, yeah.
Before you go, there's still space here too.
Oh yeah.
Space available. Yeah.
Gotta put that up on the social media. As well. Yeah. But thank you, dude. Much appreciated. Anybody who wants to get in contact with him, I'll put his social medias linked in the bio. And yeah, appreciate it.
Thanks so much, brother. Appreciate you.
Yes, sir.